just another Midwife Monday.
Hello everyone,
Hi.
We're back for Midwife Monday. And we got some great questions on Friday, so we're excited to get to them. The first question we got was from a recently postpartum mom who wanted to know about building her milk supply. She is about 2 weeks postpartum, so of course it really depends kind of where you are in your breastfeeding journey, but we'll answer just somewhat generally about building your milk supply. The first thing is we really think everyone should be working closely with a provider when they're only 2 weeks postpartum. So whether that's a midwife or if you have access to someone else, typically people who are birthing in the hospital aren't getting one-on-one breastfeeding support from the person who's involved in their prenatal care, but they may be working with a lactation consultant. So we would say if you're having struggles with breastfeeding, you should be working with a provider who's dedicated to you. But in addition to that, some of the things that you can be thinking about are, number one, hydration is the foundation of milk supply. So you really want to be making sure that you're drinking, we say at least your half your body weight in ounces of water, if not more, especially this time of year. It's pretty hot, we're sweating a lot. So it's important to be just really, really hydrating. If you're ever feeling thirsty while you're breastfeeding, you're not getting enough water. You shouldn't get to the point of thirst. The second thing is nutrition is kind of the biggest influence on breast milk. So you want to be eating foods that are nutritive. There's a lot of different sources out there for foods that you can eat while you're breastfeeding. Things that are rich in iron and protein, of course, fat, and then things that are rich in minerals and vitamins that are going to support your body to make the milk that you need to for your baby. And I think it's important to remember that when you were pregnant, you were eating a whole bunch because you had a baby inside you and you were also feeding them. But now the baby is outside you and they're still eating from your body. It's just now they don't have the container of your uterus, so they can just grow and grow and grow. So your caloric needs go way up when you're breastfeeding. So you're just really every couple of hours eating a really good quality snack. So those are like the foundational lifestyle things. And then of course things like spending skin to skin time with your baby. We recommend like really feeling your baby, smelling your baby. If you're having problems with supply, then your baby should really be in your arms most of the time. It's not the right time for others to be holding your baby. That should be you guys together because your hormones are gonna pick up on that and make milk. And then of course there's lots of information on the La Leche League website, on a website called Kelly Mom. And those have information about specific herbs and supplements that you can take. If we were working with you one-on-one, we would be talking to you about dosages and timing and things like that, but without having someone's chart in front of us, of course, we're not going to make recommendations. But we do recommend that you check out those sites, take a look, and then please work with someone directly. If you aren't able to feed your baby, then there's resources out there for you, and I would start with a lactation consultant if you don't already have one.
Yeah, and our second question that we're going to answer today came from a midwifery student, and they were asking what are the ins and outs of a 2-midwife practice and how do we make our practice sustainable? So I'm going to focus on the piece about sustainability. So first of all, both Sarah and I value off-call time so that we can do this job for the long run, and also have other things that we enjoy in our lives and have families and have pets, go on trips, etc. So in our practice, each midwife gets 1 week a month that they can take off call, and they can stay in town or leave town or do whatever the heck they want with that time. But we have a dedicated 7 days every month for Sarah and a dedicated 7 days every month for myself, and we can choose to opt in or opt out of work at that point. The rest of the month we are working together, of course, and we believe strongly in continuity of care for each of our clients. So that is the reason, one of the most important reasons that we have a 2-midwife practice, so that when Sarah's off call, I'm the continuity, and when I'm off call, Sarah's the continuity. We want to make sure each of our clients has a midwife available for them, not some other person, not a student, etc. A midwife available 24/7. In addition to that week that we take off, we each also allow ourselves a 3-week chunk every year in which we can be off call from midwifery. And that kind of depends on the year and depends on what our needs are. Maybe it's going to be maternity leave one time. This year, Sarah's leaving the country for a couple of weeks. I already left the country for a little while. And that's kind of how we do our practice in terms of sustainability with off-call time. In addition to that, we have work hours. So we work Monday through Friday from 8 to 5. And if it's after 5, unless it's an urgent call from a client, we're not available. So of course we're available 24/7 for anything that our clients need urgently and to attend their births. But we set business hours so that we can actually go home and have dinner with our families and work out and enjoy the sun, whatever it is we want to do that day. So those are a couple of the strategies that we use in terms of making our practice sustainability. Other than that, really, Sarah and I just work together most of the time to be with our clients, and we have one another for consultations, etc. So we think a two-midwife team is obviously the best way to go. It helps us with our confidence as midwives. You have a friend that you get to work with. When someone's unavailable, the other one is available for clients. There's so much that we do as midwives, and we get to split those administrative responsibilities as well. So that's kind of, in a nutshell, some of the ins and outs of what we do and how we make our practice sustainable.
Thanks for tuning in. We'll see you next Monday.